Hi, I'm attorney Rachel Cheap, and today I'd like to use this video to talk with you about how VA rates urinary dysfunction. Whether you're watching this video because you have residuals from prostate cancer treatment or because you have urinary issues related to a separate condition like lumbar spine problems or our Parkinson's, the same criteria applies. No matter what causes your urinary dysfunction, it's going to be rated the same way using these criteria. I do have a separate video talking about prostate cancer residuals and how VA determines how to rate those, which you can watch here. In this video, I'm just going to go more in depth about how exactly these conditions are rated and break down the criteria. So first things first, VA rates urinary problems separately from kidney problems. Sometimes those conditions whatever causes those conditions can be intertwined. However, VA generally is not, if it's the same cause, VA is not going to rate you both for kidney function and urinary dysfunction. They're usually going to rate you over which one is more severe. If those conditions are caused by separate issues, then you can get separate ratings. Renal dysfunction or chronic kidney disease is based on lab results, which detect how well your kidneys are working. So there's not really much you can do to prepare for that. It's just going to be based on hard numbers. However, urinary dysfunction or voiding dysfunction is a little different. So the way that VA rates what they consider urinary dysfunction is first, they have to consider your symptoms, obviously. However, they are looking at two separate aspects of voiding dysfunction. So that's going to be urinary frequency or urinary incontinence or leakage. Some people have both. And if you do, you're not going to get two separate ratings, one for frequency, one for incontinence. You're going to get one rating based on whichever of those dysfunctions is the worst. Basically, you look at the criteria, whichever gets you a higher rating of the symptoms that you have, argue for that. So for urinary frequency, VA is going to give you a 10% rating if the time periods between when you need to urinate is between 2 and 3 hours during the day. So if you're good, you can hold it for 90 minutes, 2.5 hours, but you know if you can't make it to 3, 10% rating might be correct for you. They also consider, so I mentioned the daytime, VA also considers nighttime frequency. So again, if you can go between 2 and 3 hours without having to stop and use the bathroom, but get to that 3-hour mark and you absolutely gotta go during the day, 10% rating. Or during the night, if you find yourself waking up 2 times during one night's sleep in order to urinate, then that also gives you a 10% rating. So in addition to looking at frequency and incontinence, VA also considers within frequency, both daytime and nighttime. Voiding interval is what they call it. Voiding interval meaning how long can you go before you have to use the bathroom. So moving down to a 20% rating, that's what VA is going to give you if you can go between 1 and 2 hours without needing to use the bathroom, but cannot make it past that 2-hour mark. Or if you're waking up 3 to 4 times a night in order to urinate, that's going to give you a 20% rating. Then the highest rating that they offer for urinary frequency is going to be 40%. So you are entitled to a 40% rating if you can go, or you can't go 1 hour or more without having to use the bathroom. So you're running to the restroom every 20 minutes, 30 minutes, 45 minutes. Every 59 minutes, you should have a 40% rating. Or if you are having to wake up 5 or more times per night to use the bathroom, you can't make it through a full night's sleep without, on average, getting up 5 times a night, you should be having a 40% rating. And I would also encourage, if you find yourself having to wake up 5 times per night, applying for insomnia or like sleep problems, chronic sleep impairment as well, because you should probably have a rating for that. But that's another video. The second way that VA rates voiding dysfunction or urinary problems is going to be under the criteria for urinary incontinence. Leakage is also considered, and that's what it sounds like. Either you're not able to get to the bathroom fast enough, you have accidents, or you have leakage throughout the day. You might not be at risk of fully urinating, but you've got, drops throughout the day. One thing to note is that to be rated under incontinence or leakage, incontinence covers leakage. In order to be rated under this, your condition has to be severe enough that you're wearing absorbent materials. And that can be pads, that can be adult diapers, anything that's going to absorb any rogue liquid. So again, that's in the criteria. So if you're not to the point where you're wearing pads or diapers or any, again, absorbent material, I'm sure there's other things I'm not even thinking of, you're not going to be able to be rated under incontinence. So you'd probably be better off looking at a rating under frequency if that is a problem that you have. However, one thing I do want to know is if you're wearing pads just in case of accidents and you don't find yourself having to change them every day, but you don't feel confident maybe leaving the house unless you know that you have that backup protection, you could still get a rating under incontinence or leakage. So the lowest rating that VA gives for urinary incontinence is 20%. And the way that you qualify for this is if you have incontinence or leakage that requires you to wear those absorbent materials that need changed less than twice per day. And by the way, less than twice per day includes 0. So if you're maybe in a situation where you occasionally have incontinence or leakage, so you don't feel comfortable leaving the house unless you have that extra protection of a pad, you've just got that confidence, it helps you give confidence to be able to leave and not have to worry about an accident or leakage. But then maybe at the end of the day, you find that you didn't have to change it. You started the day with the same one. That's okay. You still should have a 20% rating because you changed it less than twice per day, but you needed to have that absorbent materials. Now, keep that in mind. Moving on up in the ratings is 40%. And you're going to get a 40% if you need to wear those absorbent materials and you have to change them 2 to 4 times per day. And I hope it goes without saying, when we say day, that also means night. So if you're finding yourself having to maybe even change them more often at night, maybe you don't need to change them during the day at all, but at night you have to do it twice. So that's still going to apply, and you'd be getting a 40%. A 60% rating is going to be given when you have to wear absorbent materials and they need to be changed more than 4 times per day. So if you only need to change them I know that's a lot. If you only need to change them 4 times a day, then you're getting the 40% rating. However, if you were getting, 5 or more, then you're going to be getting the 60% rating. You also will qualify for a 60% rating if your urinary leakage requires you to use a catheter or other appliance in order to urinate. So again, that's 60%. That's where the urinary incontinence codes top out at. However, I did want to let you know, if you have a condition that's so severe that essentially you can't use the pipes at all, and you've had to get a suprapubic catheter, you get a 100% rating for that. And a suprapubic catheter is one that goes directly into your abdomen. It bypasses the plumbing completely. It's basically a tube that goes directly from your bladder to the outside, and it's emptied that way. That's rated under a different diagnostic code 7516 to be exact. But in case you've had a condition that requires you, it was a genitourinary condition, and it required you to get that suprapubic catheter, you should be having a 100% rating. So keep that in mind as well. All right, well, I hope that this video helped you learn something. I hope that it helps you get a better rating and the rating that you deserve.